thanks for everyone for coming out. I'm Dr. Bridgeman. I'm a third-generation chiropractor. So chiropractic's been in my life, anatomy, mobility. It's something that I really enjoy working with, and when we combine it with physique athletes, we can really make big improvements, not only with the way they perform, but with postural control. And who better to have up here is posing expert Tanji Johnson, IFBB Pro, best wife in the world.
Hi, you guys. I know almost everybody here, so I won't spend too much time on my background, but I think everyone knows that I'm really passionate about posing. So with my career, I started off in the military, and then I started competing. And as a competitor, you kind of develop, figure out what your strengths and weaknesses are. And I realized I had a strength and a niche for, and an eye for posing. So I built a whole business on contest prep, primarily focusing on posing. And what's been really unique and special ever since him and I got together is just seeing how our two worlds come together to complement each other in being able to better service and help our clients. So posing is my passion, and today we want to be able to just show you how it can all play and tie together.
Excellent. So the first thing I want to talk about is flexibility versus mobility. Okay. So when we think about flexibility, I'll hear this a lot of times from patients, oh yeah, I've got good flexibility, but they may have good flexibility in one direction. For example, like they can stand up, touch the floor, they've got pretty good hamstring lengthening, but then we check the opposing muscle group, the hip flexors, and they're extremely tight. So when we think about mobility, we want to think about not just muscle, but we want to think about your joint tissue, your joint capsules, your ligaments, and then we also want to think about motor control. Like, are your muscles tight because neurologically they're in spasm, they're protecting a joint, and then of course the soft tissue. So we also want to think about all ranges that that joint can go through, and that's going to translate into great mobility and ability to control your posture.
So before we actually go into the curriculum that we kind of want to move through, we wanted to first find out from everyone here if you had specific questions that you wanted us to address having anything to do with mobility, flexibility, athletic performance, or posing, so that we can just be mindful of it. Okay, Jarrell? Go ahead. Hey, Jarrell, stand up.
I always want to feel like I have to adjust my neck, like I sleep on the side or something, and get ready to
Sleeping's a big deal. You spend a lot of your time. Yeah, so Jarrell's asking just kind of about a lot of positional strain that you feel like with sleeping, and how do you maintain and keep your neck supported. So there's a couple different types of pillows out there that can help. Sleeping on your back is probably the number one posture to sleep on, with a good supported pillow. Things to consider: if you have a really thick pillow and it's pushing your head forward, that's going to lead to anterior strain. If it's too thin and your head's going back into extension, that's not ideal either. So contour pillows are great. I actually have a new wedge that I've been trying out, and I've had a lot of patients really like it, which you lay on your back and it actually helps support that curve that you're supposed to have. Okay? In today's society, there's a significant amount of anterior head posture. If you don't know what that means, it means you're doing this all day, right? So to counter back...
On our phones, right?
Yeah, on our phones, Instagram. So sleeping on your back, number one posture. Number two, on your side, again, pillow's going to be important, right? You've got broad back, so if you have a thin pillow, your neck's not going to be centered. So you need to take a look at your pillow. There's a Mattress Firm right below my office. They have all sorts of pillows you can try out. And then also that device I was talking about, that's a great device that you can start using at home.
What about the actual bed, like the adjustable beds and changing the posture that you're actually sleeping in addition to the neck, so like lower back? So like our bed goes up like this.
So what I personally do in that is whatever Tanji likes. So check who you're sleeping with and see who's going to win, wants to win that.
Are you saying you don't like it up?
I love it. Perfect.
What we're talking about is we have one of those adjustable, frames, and there's the kind that come up from the feet and then come up from the head, and we have one that comes up on the head side, and it can come all the way up. but I really like it just slightly up because I feel like it relieves a little bit of tension in my lower back versus if I sleep flat on my back, especially with my booty, there's that big arch, in my lower back, and it needs that release. So instead of putting a pillow underneath my legs, just lifting the other body gives me that support.
If you also have any GERD or gastroesophageal reflux disease, having the bed slightly elevated can help them with that.
Great question, Joel. Hey, any other questions relating to mobility?
Any other questions related to mobility or concerns? Mike went on.
I don't need it.
Okay, so no further questions. So let's move into what Tanji likes to call the posing fundamentals.
Okay, so when it comes to posing, raise your hand in here, everyone that is a competitor that's already competing, right? Most of you guys. Okay, so, and I think most of you guys have probably been to some of my classes. So when you think about what the posing fundamentals are, these are just fundamentals that if you can do all 3 or 4 of these things, then whatever someone's asking you to do posing-wise, you're going to be able to do it easier. Some of you guys have started posing, or you go to a class and you realize, okay, this is what I need to do to actually look better in my physique, but I'm limited, and it's always because of something like, oh, I don't have the hip mobility, or oh, I don't have the lumbar flexibility, right? And so that's going to be important. So what we like to do today is we want to do a couple of demos where I go over what those fundamentals are. You're going to see what it looks like when someone can or cannot do it, how it makes a huge difference in the physique, and then Dr. Bridgeman is going to talk about what some of the mobility exercises are that you can do to actually increase your mobility so that you can be more successful in your posing and present a better physique. So one of the first things is just going to be posture. So I'd like Heidi to come up here, and what we're going to do is we're going to move our chairs back and let Heidi go right in the middle. Heidi is a bikini competitor who's probably going to be competing in about 1.5 to 2 hours. So what I'd like to, and I know you don't mind if I use your personal story, so I met Heidi last year at a posing seminar, and I remember thinking that she had a really great physique, but because with bikini, everyone knows in bikini, they're going to judge the glutes, you need to stick your butt out, and the problem is if you don't know what you're doing, you see pictures and video, and you get an impression of what you think is happening, and then you try to copy that. And so what Heidi was doing is what I see a lot of the bikini girls do, and they're still going to be doing it today, but they're trying to sit so hard. So what I want you to do is give me a side pose, which is your front pose, and I want you to sit into it super hard, and I want you to lean over a little bit more. So this is kind of what I saw, and I see this in a lot of people because they're trying to sit on a hip, and they're trying to drive that hip back so that they can really have the tightest glutes because they're self-conscious about what they're showing when they're showing their glutes. The problem is, posture-wise, she doesn't have the best posture, so go ahead and relax. Okay, so that was pose number 1, where she's arching, and really trying to get that glute out. I want you to go ahead and go into it again. So go ahead and go into it again. So pose number 1, sit hard. Nice, deep, lean forward. Make sure we have a small waist, okay? And now I want you to stand up straight, okay? So I'm going to have you lean on this leg. You're going to stand super straight. You're going to keep your arms closed. So pull the stomach in. So right now, would you guys say that her posture is elongated and nice and stretched out, right? And here's the thing. Go ahead and relax for a second. So bad posing will not make your body look better. We have to be, what I like to teach is I'm going to teach proper posing so that you can see what you really have. And then if the issue is you need better glutes, we got to get back in the gym and train for better glutes, right? So we can always do so much with posing, but you don't want to pose poorly to try to make up for something that you didn't do in the gym, or maybe it's not even about how hard you work in the gym, it's just where your physique is at and the time that you need, right? So you might say, hey, this is where I'm at right now. I don't have the bubble butt that some of these girls have, but this is where I'm at right now. I'm going to stand with good posture. I'm going to present my physique. I'll do a little bit of a push, but I'm just not going to break my posture, because when you look on stage, think of a physique competition, almost like a pageant. We still want to see nice and tall. So if you are 5'11", don't look like you're 5'10". Try to look like you're 5'11 and a half. If you're 5'2", don't look like you're 5'1", look like you're 5'3". So that means everybody should be pulling up. So I see a lot of bad posture on stage. So one more time, we've got the poor posture where she's kind of slouching. overdriving the hip because she thinks that's what the focus point should be. Now she's going to stand up tall, small waist. And I mean, in literally a year, she looked like a different person. She stands out to me so much today, and she's going to be really great today, compared to when I saw her last fall. I was kind of like, there's something funky going on. And if you have really great lumbar flexibility, that's another problem, because some people do this too hard, they don't even realize it. Thank you, Heidi.
Excellent.
Yeah.
Okay, Heidi.
That was my biggest issue. Being a yoga teacher, I have a lot of flexibility, so I was flexing too much. If that makes any sense. It's so easy, it comes easy. And so I was kind of doing like the upward dog, you know what that is? And it was not looking good. So I had to kind of retract that and retrain everything, really, is what I did. And she helped me a lot, because I was like able to see the small changes. And I sent her before and after in my last show, and I can't wait to send you before and after from the first time. I'm just like, wow, I feel like a completely different person.
And it also made her stomach look like it was always sticking out because she was driving so hard through here. I'm looking at a woman with six-pack abs, but I kept thinking, your belly's out, and really she just needed to stand up straight. So Dr.
Heidi, come on over. So everybody stand up. We're gonna practice something. So we kind of came up with some moves that you can do easily at the gym in between sets. So I'm gonna have you turn around, please. Okay. So what we're gonna do is we're gonna start by putting Heidi's hand like this. Great. I want you to bend, laterally flex all the way over towards me, and even flex your spine. So bend your head, start your head, get your entire spinal column bent to this side. Then what we're going to do is we're going to go to the exact opposite side. So bend this way, keeping the hand up, reaching straight over, bending the head as well, so we can get the spinal curve, okay? And keys to success, keeping the hand up. You're also going to get some lat stretch in here, and hold for about 10 to 15 seconds. And then from this posture, change your hand to here, and let's work over to the other side. There you go. And so these are nice and easy. Just open up that spine. And some of these keys is bend that neck so you can get this upper back to open up as well. Excellent. Thank you, Heidi. So on this one, I'm going to show you some tricks here. On this one, we're going to go straight across. So think that you're just getting your spine to laterally flex. Okay, so we want just nothing but side bending. And we're going to show you some twists or some add-ons that we can do to this. Okay, thank you, Heidi. All right? All right, nice and easy. Okay.
Okay, the next fundamental, you guys can have a seat, thank you. The next fundamental, so the first thing I want you to think about when you think about your pose, no matter what division you are, is elongate and stay tall. The second is there's such a demand for shape in all of the divisions. Where in the physique world, we want to see symmetry and shape. And so some people have it straight on, you know, there's Shanique, wait till you guys see her, right? She's got some of the best shape in the world because her shoulders are out here and then her waist is right here, right? Now, not everyone's going to get that genetically because that is a lot of genetics, right? You can build your shoulders, you can avoid the, obliques and just try to keep your midline tight, and you can wear a screen for days, but if your structure is not genetically powerful in that shape, then you're going to try to work your way to increase your symmetry with your posing. So twisting has become a tool that is used a lot in all the divisions. But what I find as a posing coach is that if you are limited in your mobility, there's only so much that we can do. There's a couple of tricks I have, but the best thing is always we got to get you more mobile. So I'm going to ask Anastasia to come up. Anastasia is also going to be competing maybe around 1 or 2 o'clock today because she's going to be in the tall class. Okay, so Anastasia, I'm going to have you stand to the side in your front pose. Okay? Okay, right now, she's doing a full twist. So I'm going to have you open up the arm like this and a full twist. Okay? You know that she can do a full twist because the direction of her belly button is that way. So let's start from here. Let's line up here. So she's turned completely 90 degrees to the side. Belly button is facing this way. She's going to put her left hand on her hip, and I want you to watch as her shoulders and upper core does a full twist. Right? And then pop on the leg like you're in your bikini pose. Now, do you guys see the symmetry in her physique? Her waistline looks tiny, right? Her chest is up, she's got nice round shoulders, her arms are close to her body. So this is a really nice pose. Gets a lot of attention because the judges can still see all her core, right? They can see her obliques and that she's in shape. They don't need to see her abs from the front necessarily. They're going to see that, at some point, but they're going to see that she's in shape. They're going to see the shape of her glutes and her hamstrings. But now, if she doesn't twist, so go back to right there, right? So what happens now, some of you, especially if you're a bikini girl and you have muscular legs, if you don't twist, then you look narrow, like you're just straight up and down. And so the judges might say, oh, she's got nice legs, but her balance is off because it looks like her upper body's not very proportionate to the lower body. So she looks like she's all legs. And so I see that with a lot of people. They don't stand out because they're not showing as much of their physique as they can. They're basically just showing the legs. But she gives you that full twist, boom. Now you're like, okay, great. She's got shoulders, she's got abs, she's got chest. You see the symmetry, and it looks like an X. Okay? And that comes through twisting and relax. So Dr. B, what do you say about twisting and what? Oh, I want to give you one quick tip. Okay, let's say you have a show coming up in 2 weeks. You can improve your mobility, but probably not as good as you want to because it takes a lot of time and repetition to train your body to do this level of mobility. What can you do? So I'm going to have you face 90 degrees again. This is what I call locking the hip because for some of you to show a small waist, you need to keep your hips here. And when I want you to twist, if you do this, you show, now you just opened up all your abs. So a lot of people, because they don't have the mobility, and their coach tells them, twist, twist. They twist everything, and now they look blocky again because they didn't keep the hips tight this way. And so right now, we're going to go this way with the hips, but let's say I only want you to give me like 20% twist. No, that's way better. Good. Now let's say I tell her to twist, and she's like, that's all I got. Because usually what I'll do is I'll say twist more. And then they usually twist more, and then I keep pushing them. I'll come over and I'll hold their hip to lock them in place, and I'll say twist. And then every once in a while I'll get someone that gives me like a 1 inch, and that's it, that's all they got. I'm like, okay. All right, so the next tip is, let's say this is all you can do in your twist. You're gonna take your left thumb, put it on your hip, and without, twisting more, because you can't, so I want you to act like you can, even though she's got great mobility. I want you to slide your hand until it clips into your belly button. Great, do you guys see that? So she wasn't able to twist, but she could push her shoulder forward and get her hands to be on her belly button. So sometimes you guys are thinking for bikini, oh, I'm gonna put my hand on my hip, and it literally has to be on your hip, which means you're gonna be way back here, and the judges can't see all of your upper body. So just slide the hand forward until the shoulder comes forward and you see a little bit better shape. Thank you. So Dr. B, what can we do to increase the flexibility in the lumbar spine?
Excellent question, Angie. Here's what we're going to do. We're going to do the same thing that we just did with Heidi. So let's turn around. Right here. We'll get into that same stretch position. Right hand like this. Bend your spine towards me. You can bend the head. Nice. Start position. And you can see she's got great curvature here, so we're getting a good initial stretch. We'll go to the other side. Straight down. Bring this arm up and over. And then from this posture, what she's going to do is you're going to roll your shoulder forward and reach here. We're going to open up the low back, and we'll hold for 5 to 10 seconds as she's going to continue to reach. It's also going to get the lat. Now come back up to the start position. You're going to do the same posture, move laterally, and then you're going to throw your shoulder gently back. And actually, let's turn around. She's got a great demonstrated view of the abdominal content. So as she comes over, she's now going to roll her shoulder back and reach, and that's how you can stretch through here. You'll also see you get to that serratus. So this is going to help open up those cuts and relax. And then we would repeat on the other side. Let's go ahead and try it. So everyone stand up and just see if you can actually feel that stretch. Okay, so let's go ahead and laterally bend to this side, right? Bend the head. Let's go to the other side. Stretch over. Yep, reach over. You guys feel it there, right? Now just slowly reach back and feel the stretch in the different region. And focus on your breathing. I suggest 10 to 15 seconds at each hold, right? And this, you guys can see where some of you are limited in that spinal mobility and tight lats. Now let's bring it back, and then let's roll it forward and see if you can feel it in the low back. So stretch over, roll the shoulder, reach forward. You guys, yeah, you can definitely extend it. And then things to remember, keep your head bent. Stretch that spine and neck. Let's move to the other side and then kind of gauge yourself and see if you feel like one side is worse than the other, right? There you go. There you go. Nice, easy stretch, right? Now let's roll it forward. Let's see if we can feel it in the back. Excellent. Well, we'll do it either way. We're going to go both ways with it, okay? So when we think about it, we're addressing moving straight lateral, anterior, and posterior. Bring her back. And if you've been doing like hundreds of crunches, you're going to get shortened, right? So this is a great way to keep it open, keep that rib cage up. Thank you, Anastasia.
Thank you.
Fantastic, and good luck.
So good question is, we are showing these mobility exercises and stretches. For some of you, you may have done these before. Some of you, you may not. What would you say is a great way to progress time-wise? Because, you know, some of you guys, we had you do it, and, you know, you did it for like 5 seconds, and you're like, oh, wow, that hurt. Whew, and then that's it, you're done. While everyone else is still stretching. So, you know, everybody's going to have a different threshold for how long. Steve's like, you're talking about me. I'm like, I am. Everyone's going to have a different threshold for how long they can hold it. So we need to challenge ourselves, right? So what would you say is a good progression? Like, try to hold it for this many seconds, and then the following week, you hold it for this many seconds.
Yeah, absolutely. What I would suggest is, on these standing stretches in particular, 10 to 15 seconds of a good stretch, and then do like 2 times through. So I'd rather actually see you do it, you know, one side, the other side, and go back, and that frequency is going to keep it more relaxed. Okay, when we get into more of a joint mobility, which we'll get into the hip, that's going to be a longer hold. Okay, the hardest thing, and what I see most of the time when people are ready to do their stretches, is like when they're hurt, right? And it's not even the time to do it. So this is the hard part, and you got to hold yourself accountable, right, to do this stuff. And if you can dedicate 5 to 10 minutes before your workouts, you're gonna see big dividends.
I also wanted to, you know, before I met him and learned about these chiropractic, you know, body stretches, I am a fan of yoga. And so another thing that you guys can try, Anastasia can probably help me with, remind me what this one's called, but it's you're here, and you're gonna come down to here, and you're gonna do the full twist. Do you remember what that's called? Is anyone else in yoga?
Twisting chair pose.
Yes, there you go, twisting chair pose. Okay, I want everyone to stand up. You know you're gonna sweat, yeah, you know that's what's gonna make you sweat. Okay, so you're gonna have your hands together in prayer, right? Heart center. You're gonna drive your butt back like you're doing a squat, okay? Now, keep your elbows out, and let's twist to the right. You guys go to the right, I go to the right, and see if you can get your elbow to the outside of your right knee. You'll feel the stretch in your butt too. Stand up. And let's go to the left side. So drive the hip back and twist. See if you can get the right elbow to the left knee. Everybody feel that in their glute too? And stand up. Okay, now I want everyone to turn this way for me. And this is just a basic stretch, okay? So what I want you to do is I want you to lock your hip. So keep your butt tucked
Can I do it
in.
this way?
Yeah, you can face me. Yay!
This is us at the gym right here.
So we're gonna lock our hip, okay? Try to be true. What I want you to do is lock your hip and try to twist your upper torso and your shoulders, but do not change the direction of your belly button, okay? Right now I wanna go to the direction where everyone's facing that back wall. So the other way, there we go, hold, hold, hold. Come back to heart center, which is in the middle. Take a deep breath. Elongate, which means get tall, and twist to the left. Here we go. See if your hands, heart center is now in front of your left boob or your left pec. And back to the middle, and relax. Okay. Woo. So if you felt like you were able to do a full twist, where both of your shoulders are visible to the audience while you lock your hip, then whether you're bikini, figure, men's physique, you have an advantage of being able to create a small waistline and as far as how good that symmetry is going to be, it's going to depend on how much muscle you have in your medial delt, you know, what your body structure is, if you're tiny on the side, if it's thick. But that twisting ability will increase your chances of having that smaller waist to shoulder ratio. So all of these things that we're asking you guys to do if it's not something you are, first of all, if you don't have maximum twist, then you have to say to yourself, okay, this is gonna help me with my posing. I'm not at the maximum level. How do I get there? You have to do these things, and now you basically need to set up a protocol to do it daily or weekly, right? I always recommend daily until it becomes something that you're very good at doing, and then to be honest with you, it's just something that you do all the time. So get aggressive about it. Don't just, oh, I need to do this stretch once a week. That's not gonna improve your mobility at all.
Yeah, gotta be consistent.
Okay?
Gotta be consistent.
So the next fundamental, so I talked about elongating and posing, I talked about twisting and posing, and now I want to talk about sitting on a hip, okay? So this happens the most in men's physique, classic physique, and in bikini, where you're going to sit on a hip. So what I mean by that is the ability to sit here or to sit left. And this is going to have a lot to do with the hip. So I'm going to ask John to come up. John is a men's physique competitor. He won the overall at the Vancouver Natural. And he's going to be competing this afternoon as well. Yes, thank you. Okay. So John, I want you to face the front, square off to the audience, and just give us a regular front pose where you just kind of flare your lats a little bit. Okay, so this is his true physique. Straight on. And if you're, classic physique bikini, as we've talked about in the rehearsal, you want to make sure that if the judges tell you to square off and face the front because they can't see somebody's number, it may not be your fault, that you're prepared to face straight on. Most of you will feel vulnerable. If you have a thick waist or no hips and you don't have the best shape straight on, you're not going to be happy about this, but you got to figure out a way to do it to make it the best pose that you can. So I just want you to see John's body straight on, no sitting, no twisting. He's elongated because he's not crunched down. Other thing to be careful about, guys, I want you to crunch your abs. So breathe them in, and I want you to keep getting shorter because you're hunching over to get those abs tighter and tighter and tighter. So this happens a lot in men's physique too. So this is kind of where you have to decide, okay, I need to show my abs, it's a big deal, gotta look conditioned, but to what point does your chest cave in and then your posture gets bent over to where all of a sudden it looks like you're trying too hard, right? So it's a trick. So in men's physique, they focus a lot on abs. With bikini, it's all about the butt. So you don't want to abandon some basic fundamentals because all you're thinking about is your abs and making sure your abs look the cuttest. Because while you're doing that, you can take away from your overall presentation. So what I'm going to ask John to do now is pick your best side where you sit. And I want you to give me a slight sit. I believe for you, you sit to the right. Is that you? Is that it's time to eat? Okay, go ahead and click it. You'll be able to eat in 1 minute. See, that's smart. You got a timer for your food. Okay, so go ahead and take a hip and give me a little twist. So we're going to do two things. He's going to sit on his hip, and I'm going to let you step back with your right foot. Yep, and sit. Well, actually, you want to sit to your right, right? Yeah, you do. Okay, so kick your right foot forward a little bit. And so now he's sitting. And take a deep breath. Now come back towards me. And sit, stand neutral. Yep. Okay, I'm going to show you how far his ability is able to sit. So come back to neutral. Yep. Okay, feet wide. Okay, when I say go, we're going to sit to the left. Okay, ready? Go. Harder. Keep going. You see how far away his hip just left my hand? Come back. Okay, so when he's straight on, this is where his hip is. I didn't move my hand. Ready? Sit left. Hard. And twist while you're doing it. Boom. Okay, now keep the flare, chest up, hold that. Okay? Do you guys see how he just changed his physique? It's just a different look. And this is one of his go-to poses for men's physique. Okay? Do you guys see the difference? Give us your straight on one more time. And it could be a matter of preference. So, what's great is for a posing coach like me, when I'm working with someone, I have each of my clients go into multiple poses. I'll start from the beginning. I'll say, give me your straight on, because the funny thing is a lot of guys will want to go straight on. They'll even do the Superman pose where you put your hand on the hips because the pros do it. But what we have to remember is that a pro men's physique guy is going to have a fully developed chest. He's going to have bolder shoulders. He's going to have a small waistline. He's going to be cut through he's got the whole package. So the funny thing is the better your body is, especially if it's there genetically, you don't really have to do much. You can stand straight forward. You don't have to do any tricks. You put your hands on your hips and you're just like, bam, there it is. Most people that are coming up on the amateur level, not there yet. right? So I always try to caution people, you need to make sure you do what's best for your body. You can't just copy the pros, because they're doing what's good for their body, because they got pro-level bodies, and most of us don't. So we have to be mindful of that, right? Okay, so you choose, right? So John, give us your straight on. Okay, so now you're going to see how his lats tie in to his small waistline, his shoulder development, chest. Now give us the sit with the slight twist. Okay, there you go. 2 different poses, but he has to be able to sit. So it's great working with John because he has such great mobility that he can sit deep, deep, deep. But a lot of the guys I work with, actually I tell them to sit, come back, and I'll say sit, 1 inch. Whoop, right there. That's it, that's all I get. I'm like, okay, all right, we gotta work on your mobility because I can't do my job better until we work on your mobility. Great job, John.
Thank you, John. Good luck. You look great. Okay, so when we think about the hip, we've got hip flexion, which is this, hip extension, which is taking the hip back, and we also have abduction, adduction, and then we get into internal, external rotation, okay? So we're gonna do 2 mobilities. So we're gonna grab a floor, so let's all get on the floor.
Okay, we're coming over
Let's go over here, and we're gonna work the hip. And let's utilize this time to actually get our hips looser, right? Let's don't go through the motions. Yes, Tanji, you want to demo it? So I made a hip, H-I-P-P, so we think piriformis, and then we can do pigeon, right? So let's go down. Tanji's got a great pigeon, right? Does everyone know how to do pigeon? All right, so here's how we do it. No, come on up. Oh, okay, that's how she does. She does it a little differently. All right, so we're going to place the right hip forward. So we'll demo it and then we'll walk you through it here. So here she's going to get into this position, and
I basically start in the plank.
Yep.
I pull my knee up. I try to twist my foot out of the way. Some of you may not be able to sit. This is it for you right here. Right?
And we want to be feeling it right in here, just back of this hip. Okay. Okay. There we go. So, yep. So let's all give it a shot. So,
Here you go.
get down.
Spot yourself with your hands so that if you're tight, don't force it. But
Just-
this is a good thing to be aware of. So start, yep. There you go.
Yeah. Feel that bad boy? And just slowly sit into it. So while we're holding this position, I'm going to throw out a concept which is called scouring the joint, which basically means that you're going to put direct tension into all positions. So if we direct tension to the left or to the 10 o'clock position, hold that, then direct your attention to like the 12 o'clock and the 2 o'clock. And that way you're hitting all aspects of that joint. And that's called scouring of the hip. You guys feel that in there? Focus on your breathing, hit those ranges. Let's go another 10 seconds and then we'll switch. All right, let's go ahead. Let's try the other side. I'm going to walk through, see if anyone's struggling. Anybody struggling over here?
Drive your hip back and increase the stretch.
Yeah, nice. You guys need a little help back here? You get it? You feel it? I say, I want people like, am I doing it right? I'm like, do you feel it? If you feel it, you're doing it right. There we go. Nice. Okay, all right, now, let's go everybody on your back. Does everyone know how to do piriformis stretch? Does everyone know what piriformis is? All right, so piriformis is a very important muscle. It's the primary hip rotator. Okay, so with a name like that, it means it's important. It's also important because it'll cause sciatica. Your sciatic nerve goes right underneath, and in 25% of the population, it goes right in between the muscles. So if it's tight spasm, you get sciatic from piriformis. So, Tanji's gonna lay on her back, okay? So we go like this. All right, so what I do is bring both your knees up, just like this. We're gonna do the right leg, so we're gonna cross it. Keys to success on this, make sure that it's not on your ankle. Put it above the malleoli, okay?
Which is the what?
Malleoli is the outside ankle bone.
I just played that on TV. I don't know.
Yes.
That's why I'm here, to like help us speak in our terms.
All right, so we go here. Now we're going to bring this knee up, reach down, right hand's going to go between. I prefer to grab this tip dip. If you can't, you can grab at the hamstring. Shin bone, yes. So we're going to pull it up. She should be feeling it on the crossed leg down into the same area. And these are 30-second holds.
Did you think if you go too far or
No, if this muscle becomes tight and short, it will cause sciatica. Yes. So the piriformis is kind of like a thick, short muscle. And because of that, it takes extra long to loosen up. So this is one that you really want to, hold for at least 30 seconds, and we recommend hold it for a minute. Okay. A couple things that you can work on. If you can hold your leg in that position, you can release your hands from your knee and put your right hand on the knee, and you can push it out. Right? So you push that knee out. Exactly. Okay. Let's go ahead and switch. Let's try the other side, everyone. Good. You got it, T. You got it there. Cross. Get the IT band can be involved in that too. Nice. Good. Good. Yes. Right. Right. Nice.
Funny, look, we all not doing economy up there doing these stretches.
Okay. Excellent work. Okay. All right. Come on up. Excellent. All righty. We're gonna move into. We might have time for one more. So we can go back seated.
I don't think this is here, so I might get back. Okay. So the last fundamental, just to review, fundamentals of posings, the ability to elongate and keep your posture nice and tall, the ability to twist so you can manipulate your symmetry, the ability to sit on a hip so that you can create those angles in your physique, and the last one I wanted to talk about is the ability to flare. So, John, do you mind coming up real quick one more time? Yeah. Okay, shirt off. All right, so you kind of saw him doing this before. I'm going to try to do the opposite. I'm going to have you, let's actually turn around for a second. All right, back pose. So this happens all the time in bodybuilding, figure, women's physique. So I'm going to have you, so you're doing your back pose. First of all, in physiques, people think that to show the back, you got to squeeze the back real tight. So that's what I want you to do. I want you to squeeze your rhomboids, squeeze your back really tight. Yep, there you go. That's what I see a lot of, okay? Now that's good because I can see that he's lean, I can see that he's muscular. Now I want you to flare and stretch out. Okay, so chest up, elbows down, down a little bit more. Yep, boom. All right, so now he's out to about right here. Okay, go back to squeezing super tight. So do you see how he just lost about an inch of width on both sides? And you have to ask yourself, was it worth it? Did he get that much leaner? Did he get that much more definition? Relax. Now, for some people that have really great symmetry and they're super, super wide, they could probably be okay losing an inch off both sides just to look a little bit more dense in the muscle and conditioned. But but how many of you guys feel like you could lose an inch off both sides in your symmetry? Most guys and girls are like, nah, I need that extra inch because I'm trying to make my waistline look small, right? So imagine if you had a thick waist and then you weren't projecting your flare, it's game over. And that's the difference between having the right structure or not. So one more time, John, give me your flare. So the flare is when the lats open up through here. We're gonna go elbows down for a second, just like that. Yep, so this is this nice heart shape in the back, okay? Now, instead of flaring, you're just gonna squeeze all your back muscles to the back. There we go, right? So again, you just gotta, you're looking for that total balance of, I wanna show sick shape, but I still gotta look lean, I still gotta show muscularity, so you gotta pick what balance of that technique are you gonna use to get your best package. And relax, face the front. So now you can see him from the front pose, and so this is what I call a flare. Okay, go ahead and flare again. So he's flaring the lats forward, right? So some guys, especially in men's physique, they will flare and then they'll lift their chest up and pull their elbows way back. Go ahead. And when the elbows go back even more, 1 inch, you see how his lats are getting pulled back? His lats are getting pulled back because instead of flaring, he's pulling back his elbows. And so that takes about 1 inch away from his shape. Bring it back forward, flare back. Flare forward, flare back. And relax. Thank you. So Dr. B, what tips do you have?
One more thing. So let's turn around. When we go into the stretch, what we're going to consider are muscles that attach to the scapula and can cause it to become restricted. So we're going to show you a levator and trap stretch that's really easy. We'll do it seated. So we're thinking of the muscles that go from the top of the shoulder blade up to his neck. There's also the rhomboids. And one of the things that will happen often is we build our lats up, and the lats start down in the low back, and they come up, they cross over, and they'll form this adhesion on your shoulder blade right here, which won't let that scapula move on your rib cage, which can make it very difficult to, protract and retract your scapulas. So we can't show you all those today, but we're going to work a couple that you can implement now, and I think you'll like them. Okay, thank you, John. All right, so. Again? Okay, so let's all sit in our chair, okay? Let's sit up tall. All right, so sit up tall. Let's take your left hand, hold it on the chair, right? Sit up just like this. And then what we'll do is go like this with our hand. We'll bring it right here, maintain a nice upright posture, and I'm going to stretch my head straight over to the side. And I'm going to gently increase the tension on the stretch. The reason we hold on the chair, if I go like this, I don't get the stretch. So we want to distance the ear from the shoulder. And I'll hold this for 10 seconds. And then what I can do is I'll gently rotate and kind of point my nose to the opposite knee. And I'll stretch forward, and then you should feel it pull down the back of the neck just a little more. And these are very gentle stretches, and I would do about 10 to 15 seconds. Let's switch sides, similar to the standing spinal stretches. So we'll try it again, sit up, bring it over. Same thing we did with the neck. You can bring it over, just gently stretch it forward and down. You can also gently stretch it back to stretch the scalenes and the anterior neck musculature. So this is a big deal, and it can really reduce headaches, tension, and improve scapular mobility. Everybody like that one?
How often? How long did you say?
10 to 15 seconds, 2 times through. You can do that like 5 times a day. Keep it nice and loose. We doing okay? Okay. And then one more, and I thought we would all do a buddy. And what we'll do.
Who doesn't have a friend? Just kidding.
Grab a friend, stand up. And so we're going to do a nice buddy stretch for your chest. Okay? Buddy, okay, so everybody go like this, keep your hands out, hand behind your buddy, thumbs up, bring your elbows back. Yeah, we're just going to gently pull the arms back to your friend's tolerance, as she's going to focus on keeping her chest nice and upright, and then giving her, command. Arm should be right about at the scapular plane. So we're going to stretch back. And then if she says, okay, I'll give a little extra.
You see the difference over there?
Yeah, in the back. No. Just like that. Good. And I would hold those for about 10 to 15 seconds.
So I wanted to point out that.
Okay. There we go. Okay, so think about the pec, right? So if we're stretching the pec goes from here to here. If I'm down, I'm not going to get the stretch. So you want to keep it up. It's almost a little up and back so that we get the elongation.
So try to keep your arms shoulder width, because as you let your arms fall, you can go back further thinking that you're more flexible or that you're getting that mobility, but you're just targeting a different area. Nice work, you guys.
We've got time for one more, which, oh yeah.
So her question is that she notices that while she was doing the stretches and going through the series, that she was way more mobile and flexible in some areas and not so much in others, and if that is normal.
It's common, right? So we have things like handedness if you're right hand dominant, and so those are the kind of the silent killers that, I don't know, doctor, I don't know what happened. All I was doing was, picking my cat up and my shoulder and neck went out. Or
It's a fat catch.
yeah, right. So those things creep up, and that's why you want to do mobility, so you can actually get just a feel of checklist of how your body's doing. And as you do it regularly, you may wake up and do your normal stretch, which doesn't bother you, and you're like, oh wow, I'm extremely tight in there. And then you got to figure out what you can do to correct that. Okay, so excellent. So this last one we're going to do is, in my opinion, the most important, right? The foundation of your spinal column is your pelvis, right? And the most important muscle in the body, does anyone know the most important muscle in the body? Besides the heart, but that's cardiac. We're talking skeletal muscle. Booyah. The psoas, right? The psoas is a big deal. It's attached on L1, which is the first lumbar, L2, L3, L4. It runs down right here on the hip. That's what does this. This is your primary hip flexor, okay? The psoas. And when we get into bikini especially, we can see that this becomes a problem. So we're going to look at that now, and I'll show you the solutions.
Okay, so fundamentals for posing. There is the ability to stand tall and elongate, being able to twist, being able to sit hip to hip. Then we talked about being able to flare and open up your shape. The last one is going to be being able to work the mobility of a pelvic tilt. So I'm going to have you turn sideways. So in bikini, figure, there's a lot of sticking the butt out, right? So it's funny because sometimes to get the glutes to look a little fuller and tighter, I'll tell my clients, okay, pop the butt out. And then I'll say a little bit more, and they're like, that's it, that's all I got. All right, so I want you to just give us 3 full range motions where you pelvic tilt in and all the way out. Okay,
I'm
now
going to
do you
bring
see
some
this?
up real quick.
Go ahead.
So I think there's a lot of confusion between anterior pelvic tilt, posterior pelvic tilt. We're going to answer that for you right now. Okay, so this is the anterior, right? So go ahead and tilt and stick your butt back. Stick your butt back. See how the pelvis goes forward? That's anterior. A good way to think about it, like if you look at Donald Duck, right? His butt always sticks out. That's hyperlordosis, so increase. Now go the other way. This is posterior pelvic tilt, right? Like Pink Panther, who Pink Panther is, right? So that's a posterior tilt, okay?
So I was working with a women's physique client, and she couldn't hit her ab pose because she's having a hard time doing that pelvic tilt, right? So she's like this, with her butt out and her legs flexed and no abs. She has them, but just not showing them. And it took us a while, standing in this position like they do, to be able to do that pelvic tilt in so that we can crush the abs, right? But with figure, that's not how we show the abs. We actually do the other pelvic tilt where we stick the butt out, we elongate, and we're not flexing the abs, you're just drawing them up, and then it's a different look. So you guys see the difference when you see the figure abs and women's physique abs? Totally different, right? Or if you see like front double bicep bodybuilding, drawn out abs versus the sitting on the abs, 2 different things because of those 2 different motions. So one more time, I want you to look at the difference in her range of motion. I mean, that's big time. So hand is right here. Go ahead and do the other tilt. Draw in, draw in. I mean, she's like 6 inches away from my hand. But some people, they can only get 1 inch of movement. That's it. They're like this, right? Versus here, here, here. So we recommend get to the club, start twerking, and just really working that core. Just kidding, but I'm kind of not, because that's pretty much where I get mine from when I was in my 20s. So thank you, Anastasia. So what can we do about that, Dr. B? Good thing you didn't know me in those days, because he's not a dancer, so he would have been able to hang. I've been scared.
She might be right. All right, so the most important mobility is this one right here, because your entire posture is going to stem from it. So to do this one, and I want to test everybody on it, we're going to go to that wall. Okay, so come on over. We'll all line up. John knows this one, right? All right, so everybody stand on the wall. Actually, everybody go down, feet on the wall. Everybody right here, hands on the ground. Yeah. All right. Here we go. Okay, so we'll get everyone down here. If your shoes come off easy, I like to do without shoes, otherwise it doesn't matter. All right, everybody lined up? All right. All right, so we're going to take everybody raise your left hand, right? Got it? Left hand, good. Now, put it down. Now we're going to take your left knee and put it back to the wall with your foot pointing up. All right.
So you're trying to get your left shin up against the wall.
Nice. All right, everybody doing okay? Now what we're going to do is we're going to bring your right foot up on the ground.
And if you can, see if you can prop your right foot up. If you can't, what is the alternative?
So if you can, what we're going to do,
Keep sitting on the
you're
knee.
just going to stay on the knee. Okay, we'll work with that later. All right, so we've got the foot up, and let's see how good our mobility is. So what you want to do is you want to push up and try to get your back up to the wall.
See if you can sit up and lean up against the wall with your chest up.
Okay. So what'll happen is, if you can't get up to here and you feel a great deal of tension in the quad, it tells us your quads are way too tight, right? Your part of your quads is your secondary hip flexor, right? So what that means is you need to practice this mobility in that position and progress up. But it also means you need to bring out your roller and start rolling on that quad.
Yeah.
Okay. So once you get up to here, you're doing great. You can then get to your psoas, and what I can do is I can actually reach up and over, stretching this.
So those of you that are in the full position, you're in a lunge, your leg is all the way back. See if you can lift up your left arm and pull to the right. Reach over to the right. Great, Jen.
Excellent. Now this mobility, let's say you can't raise your chest up. So let's all go back down to the foot position. Put
Hands on the ground.
Hands on the inside of the foot that's on the ground. Just hang out there for a second, and then just lunge your left hip forward, and you feel how you can accentuate the strain in that quad. And you got to hold it 30 seconds. All right, now let's go back down,
Switch legs.
and we're going to compare and see if you're symmetrically tight.
Symmetrically tight or
Okay, so let's
asymmetrically
go right
tight.
knee back.
And what happens if they have a hard time flattening their foot up against the wall? What does that mean when they're
You
so...
need to do the ankle stretches.
Okay, so you may find that your ankle is so tight that you're not able to stretch it flat against the wall.
Now, how would you rate it? Better, worse? Who's even? Evenly?
Who feels evenly tight or mobile? Okay. Who can feel the difference between one side stronger than the other? Okay.
Right. So, you guys hold that for a second. So if you're uneven, so picture this. If you've got double muscles supporting your pelvis and one side is really tight and the other is okay, it's basically pulling you off to one side, right? This is going to be a big cause of like disc bulging because that pulls all the weight of your spine unevenly on the disc, and the disc will bulge to the opposite side. This is the primary mobility that I like to start my patients with because it's a big deal, and everything's going to be secondary to that hip. So if you have neck problems, check this out because it may be that your hips are so tight that you're pulled forward. Does that make sense? So we've got a couple prizes, right? So you guys like that one? We saved the best for last, right? All right, come on up, sit down. We're going to do a couple giveaways. That's okay. You got 5 minutes?
So do a couple questions.
Okay, does anyone have any questions?
All right.
Yeah.
As an athlete, I have scoliosis, so I find that my muscles are pulled one side in this area and my lower back area.
Yeah.
So when going through stretches, working through those stretches can help me,
Absolutely. That's gonna help prevent that curvature from getting worse, right? So that's gonna set the curve in your spine.
that's just the jeans, my kids wear jeans, and I'm trying to do that pose, and my foot up. It's, yeah.
Yeah. So it's never, I mean, it's always a process, and you always want to work on that mobility. So we've got a couple of giveaways, okay? We've got a training log, training journal, 2 of those. And then we have 2 of the mobility books, which has all of these mobilities in them, okay? And we're going to do something super fun. Tanji is going to pick a number between 1 and 100. And the closest 4 people, the 2 closest are going to get the journals, and the second 2 closest will get this, okay? All right, she's got it. All right, what's the number?
55.
23.
77.
45. 43. 58.
We go in the corner.
82.
All right. What do you got?
So my number is 6 because it's the day we got married.
Oh, by the way, which is next week, May 6th. All right. So who's the first 2 closest?
Yeah. So what was your number? 17. So who's got the next lowest number after 17?
Go. Excellent. All right.
Okay, I'm gonna do it to you. So you pick a number between 1 and 100, and it doesn't get to be our anniversary date.
I got it.
All right. Let's do it again.
Okay.
Except for the people that won. Oh, actually, you guys might win twice because it's a different price. Okay. Say it out loud. Okay.
71. 100.
79.
21.
You guys just walked in, have no idea what we're talking about. And then back there. Okay.
44.
43.
99. 30.
30. 54. Okay, what is
It
it?
was 40.
40. So did somebody have 40? Who's closest to 40?
I have 30.
You had 30? And what was yours?
37.
37? I think you're the winner. So you had 37. Who else is closest to 40? I know you have 30. Who said 43? Okay, so those 2 winners right there. So if you guys are interested in, we do have my husband has a special going on right now. It's the Emerald Cup special for $75 over in Bellevue. If you come over to our office, he will do a full examination and mobility assessment, and that is also going to include treatment, and you also will get your choice of a mobility book or one of our Bridgeman Health Solutions t-shirts. So that's the special that we have going on. For me, I'm offering a special for a 1-hour posing private or a 1-hour physique assessment or contest prep consultation for $95. It's normally $125, but that's only if it's booked today. So if you're interested, come see us at the booth. We are in the very first row right next to Stan the Cooler. Where did he go? Right there. So he's up next. Thanks everybody for coming. We appreciate it.